Diagnosis by visceral organs. We continue discussing lung illnesses. Wind heat invading the lung. When exogenous wind and heat attack the lung and the defensive phase, they impair the lung's dispersion and depuration functions and cause dysfunction of defensive chi. The typical syndrome of wind heat invading the lung is as follows. There are cough, productive of thick yellow sputum, sore throat, thirst, viscid nasal drainage, and fever with mild chills. The tongue tip is red with thin yellow coating. The pulse is floating and rapid. Heat accumulation in the lung. Heat accumulation in the lung usually follows wind heat invading the lung or wind cold gelling in the lung and after a long time transforming into heat. As heat increasingly accumulates in the lung, it impairs the lung's functions of dispersion and depuration. The typical syndrome of wind heat in the lung includes cough and dyspnea, sputum that is yellow and viscid or foul-smelling, purulent and containing blood, fever, thirst, chest pain, dry constipation, and scant dark red urine. The tongue is red with yellow coating and the pulse slippery and rapid. Phlegm dampness obstructing the lung. This condition mostly results from an insufficient spleen failing in its functions of transformation and transportation. In some cases, improper diet injures the spleen so that water and dampness accumulate, ascend to the lung, and impair its functions. When phlegm and dampness block the lung qi cannot disperse normally and symptoms result. In this condition, coughing easily produces profuse sputum that is white. There are also chest tightness and distension or labored breathing with gurgling. The tongue is pale with white greasy coating. The pulse is slippery. Thank you for listening.